also the leverage got this question in between, and so let's clarify all the questions. Actually, by the last AIM training, this was, I think, was in Portugal. I said, now is your chance. If you go out and you cannot sign that all your questions were answered, you don't get a certificate. Yes? It's fair, huh? Because I don't make a test. I don't have you make some test, but I want you to say, all my questions have been answered. I cannot give you a certificate if you still say, I'm a doubt about this.
Yeah.
And then one girl from
Norway.
From Norway. She said, but that's completely unfair. I have all these questions. And okay, you ask those questions now. Yeah, but if I still find out, then afterwards I still had some question I didn't ask, and I have signed that I asked all my questions.
Yeah, and
I gave my soul away.
She was completely scared because I paid the trip to come here.
She paid the trip. And I gave her the option to sign, just to sign, all my questions are answered, but she said, I cannot sign it because it's maybe not true. See, it's maybe not true. I may find out next week that I had some questions that were not answered. So I cannot sign this, and she did not get a certificate. She did not want it, and she's still complaining to me on the internet, on the email. She has a trauma from this training. Because I asked for something absolutely brutal to certify a disclaimer. I have asked all my questions. Imagine. So
it was only a piece of paper.
Be sure you have to be ready to sign this. Yeah?
I don't know.
You don't care. So now again, one of the questions that was asked was. So what's the difference between the Health Navigator, for example, and the LaesEr? Do I need both, or do I better have this one, or do I need only the Health Navigator or the Health Integrator, or which one of them? And this is not, I'm not making this up to sell, but this was really a question. So now
I can testify.
Okay. So the first thing is, why do we have still the Health Navigator and the Health Integrator? Looks like the same. Yes, they are doing basically the same, even the integrator has this LaesEr output, which the Health Navigator doesn't have. But on the other hand, we have here the possibility to adjust the volume, both sides. It's good if you don't want to burn a hole in some people's head. It's valuable, yeah. It can be good. And then also it has the information plates where you can inform remedies globally. So it's our therapist device. But then immediately people say, but the Health Integrator is only half the price. So why not get the half price thing? And it's true, you would not lose much if you get the Health Integrator. That's why now and in future we will not make certain program parts available that are clearly for the therapist. Because our intention was to make a device really affordable. We make not much money on this one, where we make still some money on this, because we want to have it go out to many people. So this is the device that you can buy possibly 5 or 10 or so, and then rent it out. Rent it out to people and charge maybe $5 a day. $5 a day, that's $1,500, if I'm correctly, about a year. If you rent it out, you have it already within 1 year. You have it paid back. Yes. So this is the idea, and it should be very simple to use. We don't need any programming for remedies, but we want to make it available that people can treat themselves with all the possible modalities. Yes. So you can even plug in our mind resonators. You can plug in the infrared pads. Yes. So that's the only thing. It's about the same possibilities, but if you have this one only, we will not allow you, enable you certain parts of the software, like the dual channel system, for example, to find resonant frequencies. This is only for the Health Navigator and other things more. So, and then the other thing, well, should I get only the LaesEr, or do I need both? Yes, you can buy just the LaesEr, and then you have what we have as a regular, it's a regular bioresonance system. But even more than this, because regular bioresonance system, there's no measurable feedback. Here is a measurable feedback. You can just plug in the oscilloscope here, and you see there is a measurable feedback from the body. And if you create a higher amplitude here, you also see it go up. Yes, but the maximum you get in the back is, I think, about 20 millivolt. So you can see, you can use it as a diagnostic device, you can use it as an EDS device, for example. You can do many things with this device. You can do a real biofeedback, a real bioresonance, and you can see it and show it, but you cannot make it sensible in the way that you can when you have the Health Integrator and the Health Navigator. Because then you amplify this 20 millivolt to up to 14 volts. And then you feel it, then you can drive the LED pad or the magnetic applicators or plasma device. So it's really not a replacement. So now the question, what shall I start with? If you have nothing, I would say start with now we have an introductory package less than $8,000 for the LaesEr and the integrator, and then you can do TENS therapy, magnetic therapy, pulsed magnetic therapy. You can do soft laser therapy. You can do infrared therapy. You can do the plasma therapy. You can then do bioresonance. You can deform substances in a much superior way with own resonances, with your eigenfrequencies. I mean, there's about 20 devices in this too. And you don't need any software. So for less than $8,000, you have a package that's like usually $100,000.
You won't get another package like this. I know the market very well, and you won't get another package for this price.
For this price,
even for this whatever stance is like 3,000 euros.
No, I can do this. I can do this because I don't need more money. I want that it goes out and helps a lot of people and makes it really, really popular. So this is no question. And then also all the possibilities you have when you then add the core system. Once you have it and you see good results, everybody wants that core system, of course. Then they can add the frequencies, match them here, really make it into the LaesEr, the live amplification by stimulated energy eigenresonance. So the stimulated energy comes when you have the core to put in stimulation frequencies from the core. So so much about this. Good.
Not good enough.
Wait. Good, she said. So, okay.
We already have the
Health Navigator.
Health Navigator. So the difference, as I understood, with the LaesEr, we can make more energetic treatment.
With the LaesEr, it's a completely different thing. It's about before the core finds resonant frequencies, information, and it puts it out, and basically you get something. That's already much better than any TENS therapy, which doesn't know anything which frequency. Yes? It's much better. But here, what we are doing, we are taking your eigenfrequencies, your frequencies, and giving them back to you. And if we want, we can match them with what the input from the course is. So it's a completely different thing. Nothing has ever been done like this. That's why nobody could show the biofield so far. Yes?
But still.
But let's hear the but.
Why should we have the two systems?
Because they're different.
No, because one is you see, this is really the beautiful thing that I was given a way to make double money. Yeah? Because I mean, before I had only one time making money, now I have 2 times making money, and it makes a lot of
I'm
sense.
serious.
There's a difference.
Yeah, but you can heal the same way, or you can inform.
Well,
No,
you study 11 times, people come to you and they say, I just don't feel anything. Now with this, you can make them feel on the first time something. See, and it's the thing. See, you just have to find the right channel and the right channel of people.
Okay.
Yeah. So, see, I'm using everything that I'm learning. I'm supposed to be the best student here. So, on eye level, this is my. So now what we can say? Did I say this is a panaceum? That you can cure everything with the core?
No.
No, I didn't. And I think I'm just surprised every day how much it can cure. And I mean, what the quantity they is more than I expect. But this now will raise the proportion even higher. You see, and I think it's
more potent.
no, together, but the main thing that it is, it's more easy to use, and that's what was always my concern. That's why I have 1,000 pages on the internet with frequently asked questions. We have more than 1,000 pages with frequently asked questions. And still people say, it's all good, but I really don't understand this completely. Yeah? See, and this was the problem. And with this one, I know, even if I'm stopping teaching anything, this will work. This will work because you can just know that people's resonance. This changes you, and this biofield thing, you can even see it. Okay, thank you. No more.